Hey everybody out there, sorry it's not bright, but I'm light sensitive. Today's October the 5th. If I don't have stop, it sounds like there's a trimmer mowing the grass, and making noise. So I'm gonna try to keep going through. Again, today's Tuesday, October 5th. I believe it's 10 weeks or 70 days post-surgery today. I'm going to try to keep this one short. Some of my previous videos are long, some of them are shorter, but most of them are longer. I thought initially when I started doing these they might be 5 minutes, but I ramble on if you watched even half of mine. Again, if you're just stumbling on this video on day 70, there's a lot of previous days. I didn't go week to week. I did sometimes weeks, sometimes I did by day, sometimes I did 4 days, 2 days, sometimes I did more frequent or less frequent depending on how I felt. But again, I haven't done one in at least a week, I think, in a video. But today on day 70, not much has changed. Again, I'm still on a roller coaster ride. I've started integrating some of the things that I'm accustomed to having, like tomatoes. I've had, not recently, but a week ago, 2 weeks ago or so, I had a piece of pizza. Didn't have any symptoms. I've had pico de gallo with guacamole and with onions and stuff like that. And I'll go inside and what's it called? The trimmer's getting loud, so I figured I'd just come inside and finish, even though I wanted to be outside for a second. Sorry about the camera moving around. Trying to find a spot for it. So I've been able to try pizza, salsa, tacos, pico de gallo, which again to me is not spicy, but it's tomatoes and onions and maybe a little bit of jalapeno. I think they might put that in there. At keto, so I've been able to have that, but I'm still, and it's again, if I have pizza on a Friday, you'd think Friday night into Saturday morning I'd have heartburn or some of the symptoms, which for me, again, if you're just stumbling on this video, my symptoms are nausea, water brash, which is hypersalivation, excessive saliva, and a extremely horrid tasting water taste. Water tastes really bad. I haven't been able to drink water by itself without some sort of flavoring in it, like Mio, Crystal Light. I drink Mio, just squirt it in there. I haven't been able to drink water in probably 7 to 8 weeks. I drink a little bit when I'm brushing my teeth, morning, night. If I'm taking a medication or something like that, I take an anxiety medication, but it's just small sips. Sometimes it's okay, but then if I keep going, it's just like somehow drinking water triggers the disgusting sour taste and then water brash and the hypersalivation and then the nausea. So, but I'm eating anything I want. I haven't gone overboard. I haven't had a green chili burrito for dinner and then having lunch had a piece of pizza and wings and then for breakfast having something else. I haven't done that. And I don't know that there's not a trigger food. I used to think, oh, there's a trigger food. Like I knew something really fatty would get me. I knew something really spicy would get me. And now it's just like gonna have a piece of pizza on Friday and I'm okay Friday night, okay Saturday, but then Sunday somehow I'm just like not, again, feeling some of the symptoms. And the fact that, again, I cannot drink water. So am I happy I did the surgery? I don't know yet. Right now I'm on the fence because I still have symptoms and in some cases worsening of symptoms. I think in the last video I said I've gotten over a hump and I'm able to eat that stuff, but I still have symptoms. So okay, I'm able to eat some of that stuff, but I still have symptoms. Is this how it's going to be? No. Did I really not need this surgery, and was it something else? If you've watched previous videos, I'm not suggesting you have to go through all those, but they did find gallbladder sludge. Is my gallbladder still an issue? They don't seem to think so, but they told me to go talk to the different surgeon to see, and I haven't done that because I'm trying to be patient. As they said, you went through a major surgery, be patient, and it could take you a long time. Okay, fine, I'll give it 12 weeks. Here's week 10. So 2 more weeks and even longer. I'll give it another month beyond this. And I might even say I'll give it till January 1st. And I still got a little bit less than 2 months. I'll give it to January 1st before I really make a big stink and say, this didn't work. So we'll see. But is it my gallbladder? I have a deviated septum. Is what I'm tasting mucus and something that's draining in my nose, my throat, down in my eustachian tubes? I do get a lot of, not to gross anybody out, so pause for or fast forward about 10 seconds. And I'll, if you don't want to hear me hawk something, but and spit it out. And is that part of the problem? I don't know. That mucus, that drainage, that whatever down my throat, is that what's causing or contributing? Not my job to say, right? I mean, I'm not a doctor. I go to them and rely on the experts for an opinion. And then they say this was going to work, and they were confident, and they still are confident. A couple weeks ago, I think 2 weeks ago, I was there. But I also have, at least from what they've told me, and suspected, I have irritable bowel syndrome and other issues, constipation. I have a lot of issues. So I've been on a laxative for I haven't had a normal, movement there since the surgery, which was on July the 20th. So it's been well over 2 months. Again, 10 weeks since I've had a normal one. I've been on a laxative that time. And just my stomach's messed up. A lot of bloating, a lot of gas. And I know I've seen in previous YouTube posts about someone that can't, maybe it's not just YouTube, it's other, research, use the term loosely, but what I've seen people say and do. And here comes the guy that's weed trimming. So they won't be in my backyard that long. It's HOA. I'll pause. Oh, it's not that loud. So I forgot what I was saying. Sorry. Just to pause for a second. So with my irritable bowel syndrome, laxative, constipation, things like that, the complicating factors. YouTube videos, any research that I've done using the term loosely, I've just seen people say, I'm not able to burp again. And that was more so with the Nissen and the Lynx. I'm able to burp, but not like I was before. I used to have these, if I mention this again and you've seen this, I apologize, but repeating myself, I used to be able to swallow some air, and then I would be able to produce a large, what my wife would call a dinosaur burp, and it would, but I can't do that anymore, or I haven't tried to do that, because even in the past I had trouble burping. Sometimes it just would get stuck, and maybe that was part of the problem. I was doing that, and it was putting pressure on my stomach and my diaphragm, and so I'm able to burp, but I can't do it like I used to, and I feel like that's caused more gas, because if it doesn't come up this way, it travels down through intestines and everything, and guess where it comes out? It comes out the other end. So I've been extremely bloated and gassy, and flatulence like nobody's business, and it's wretched. It's horrible. Maybe that's not the case for you if you have the surgery, but for me, a lot of Gas-X, and sometimes it helps, sometimes it doesn't. It's usually when I lie down too. When I'm standing up, it's not as big of a problem. When I lay down to go to sleep, it's just like unleashing the hounds. So I'm having a box of matches specifically for that purpose. So it's bad. Not that you want to know all this detail, but again, this is what I'm experiencing. Is this part of the surgery? I don't think so. I think it has to do with my IBS and my other issues. I am going in for a colonoscopy, if I didn't mention that before, on December 1st. They're going to check for polyps and other things that, who knows, cancerous, not cancerous. We'll see on December 1st. But I haven't had this much gas and bloating and stuff like that prior to surgery, so I'm assuming that, again, it's either going to get better over time or it's just not, and I might just be gassy and bloated a lot. I guess it is what it is. So yeah, but again, not really much in terms of diet has changed. I've been eating whatever I wanted to since the surgery. I was at my lowest point in terms of weight. I was at 140 pounds. Now I'm at about 148, so I've gained a good amount of weight. And again, 140 pounds is way too light for me. I want to be at 160 to 165, and not really over 170, but I want to put on my weight and my muscle mass that I just really lost. So if you've gotten this far in the video, what I will tell you is I'm not sure if I would say yes, get the surgery or not right now. For me, I'm still not there yet. I think if you've done your research and looked into it and heard what other people say and you're confident you just can't live like this, I think that it could work for people that don't have other issues like I have. And even if you do it, they tell you it's 6 weeks. I'm sorry. Most of the time I really believe science and doctors. I don't believe them. I find it hard to believe that if you have a TIF and a hiatal hernia repair, you're going to be anywhere near normal at 6 weeks. It's going to take you at minimum of 8, and that would be if you're lucky. I think that's probably going to take you at minimum of 12 weeks before you feel like I'm normal, no symptoms, all that kind of stuff. You're going to lose a ton of weight. Maybe that's good for you if you're overweight or obese or something like that. But if you're not, just accept you're going to lose a lot of weight because you just can't eat. It's similar to a gastric bypass kind of surgery. You're just not going to be able to eat. So it's going to take a long time to recover. Make it clear with the doctors if you have any other complications like I did, and I didn't do the problems that I have but didn't fight them on it. I should have gone in and said, I have major problems with irritable bowel syndrome and constipation, IBS-C. Can I take a laxative throughout the whole time I'm on recovery? And just get the clarification. And the answer would have been yes. Can I have this at this time? Can I have that at that time? Because, as detailed as the guide they gave you, it wasn't as detailed as I would like it to have been. And that's me. But again, something to think about. So sorry, got distracted again. Long time for recovery. You're going to lose a lot of weight. Be very clear with the doctors what you have questions about. I haven't been shy necessarily, and I would think that they thought I asked a lot of questions. I still don't think I asked that many questions. So I like to think I'm a fairly educated person. I have a master's degree. It doesn't mean I'm smart. Hopefully it means I'm not too stupid, but I still feel like if I don't know the answer to something, I should ask. So I'd say don't be shy. Ask your questions. Make sure you know what's going on and what you expect. But again, the recovery is going to be much longer than you thought. You're not going to be able to eat what you want. It's just going to be a long process. And again, for me, I have all these other complications, so I'm wondering how it's going to work. So maybe I am pretty healed. Maybe I can eat what I want. Maybe it's my gallbladder that's the issue. Maybe it's my irritable bowel syndrome, constipation that's causing some of these problems, which has similar symptoms. Nausea, not water brash, but the nausea is a symptom, and bloating, that's IBS-C. But is it my deviated septum because of the mucus and things like that? And I taste blood, and sometimes, and I'm always, when I blow my nose, it's not a lot of blood, but there's blood in my tissue. So again, that's a whole nother issue you're not here to hear about. You're here to hear about the TIF and the hiatal hernia repair. But for me, unfortunately, I think there might be some correlation. I don't know that that's the cause, but correlation doesn't always equal causation, but there may be some correlation and overlap of the symptoms between IBS, deviated septum, and the hiatal hernia and the TIF and all that stuff. So, and here comes the lawnmower, so I'll stop. So hopefully that helps. Again, I'll give another update as soon as I have more news, but I really don't have much more to say beyond that, other than, again, hammer it home one more time. It's going to take much longer, in my opinion, than they tell you. It's going to be a long journey, not going to be 6 weeks. I think you're lucky if it's 8. I think you're lucky if it's 10. I think it's going to be much longer than that. And I'm not sure. I haven't been there before, but will it take me, again, I mentioned this in previous videos, 10 weeks, 12 weeks, 18 weeks, 20, 24? I don't know yet. So, and again, if my other complications, for me, it might be longer. For you, I wish the best and hope and pray for you that it doesn't work out like it did for me and you're back to more normal. But just bad, because I had a protein shake earlier this morning, and then I tried to drink my Mio flavored water shortly after. Get that milk protein shake, and you're just like, the protein shake is thick and it's in your mouth and you want to rinse your mouth out. The water tastes even worse after that. But that's not always been the case. Usually that helps. The water, rinses out your mouth and you swallow that and it comes out. And this protein shake doesn't have milk or milk products in it. Not that I believe. I've looked. Unless it's got some milk ingredients, but it's not milk itself. It's not milk. So, and it's not always been like that. So it's just occasionally it's like, well, I drink this protein shake and I drink some water, and the water goes down. And it's just horrid. Um, and I'm having to suck on a cough drop to try to get that yuck, horrible, awful taste out of my mouth. So, um, I don't think I hope these videos help you, somebody that's watching them, but I don't know that it's going to be too helpful if I have too many other complications that are not normal for whomever's watching this. Because of all the issues I mentioned, maybe it's just not going to be a one-to-one comparison. It never will be. Everybody's different, but I guess again, I hope that somebody finds this useful. And even if not, if I'm not here, then my wife and my daughter have a lot of me talking nonsense, and they can at least remember what dad and husband was like in his complaining stages and talking about this horrible process that I've been through. So, and I don't want to scare anybody that's trying to go through this. I don't think it was the surgery was not a problem. It's the recovery that's the problem. I think the surgery is relatively simple, and it's a major surgery. I didn't feel like that. Maybe it's because I'm healthier, I'm lighter in weight. I don't know, but I just felt like I had more pain and discomfort, and was on pain medication with a knee scope in 2005 that I had, 2005, than this one. Not that I didn't have pain, but it was managed with Tylenol. My knee scope was not like that, and the physical therapy and rehabilitation with the knee scope was hard. But this is different. It's food. It's what you eat and how you have to eat, and especially if you want to eat, then if you want to eat anything really, then it's hard. But again, that's the hardest part of it. But if you don't care and maybe you eat healthy anyway, and you're just unlucky like me, and my brother, for example, is a bodybuilder diet, so he doesn't care what he eats. He just eats. He doesn't have to taste anything. It's fuel. So he just consumes fuel, and for me, I like to enjoy what I'm eating. So that's the hardest part. The hardest part is just not being able to eat what you want, being on a liquid diet for such a long time, losing a lot of the weight mentally, psychologically. Have a counselor if you need one. Get help, because you can I burdened my family. It's hard on my family. So try not to burden your family, and have a counselor. Talk to them about your struggles and ways to cope, because it's a journey. I won't lie, to be blunt. It's not always perfect, and I didn't have it as bad as I've seen, where it didn't work and it caused more complications. They had to go back in and do it again within a 6-month period or a year period or whatever it might be. And who knows, maybe I'll still be there. I don't know. Will they have to go and do a gallbladder removal? I don't know. But hopefully it goes better for me in the future. I'll keep you posted as I have more updates, but that's all I have to say. And again, I said I was going to be short, and here it is, almost 20 minutes in. So if you've watched my videos, hopefully you can find some little bit of humor in it too. But if you knew me, you knew that I just, and my wife would laugh if she sees this in the future. That's just what I do. I just keep going and going and going, and that's the end of it. But I just keep adding to it. So, and I'm still doing it right now. Anyway, hope it helps somebody. Feel free, again, if you get this video, I try to respond to all the comments. I don't get a ton, and I'm not after anything. I don't care. I don't want any money. I don't want any, and then I'm not going to be famous for this stupid nonsense. I just want to help, and if it helps you, I'm here. And if you have a comment, you have a question, I'm happy to answer it as best I can. And I'm not perfect, but the only reason I'm doing this, because I'm a very introverted person, whether you know that or not. I do not like crowds. I'm very introverted, and the only reason I'm doing this is because I know there's a lot of people going through the same problems I have, and worse, far, far worse than I have. And I hope there's some benefit to this. So thanks. Have a good one, everybody.